But let's turn our focus now to the United Kingdom, and Prime Minister Boris Johnson there on Sunday faced calls from experts and opposition politicians to impose a nationwide lockdown in England as coronavirus infection rates reached their highest levels on record. Johnson said earlier in the day that the onerous lockdown restrictions were likely as a variant of the virus has pushed the daily case beyond 50,000 for the past 6 days. In fact, the president of the Public Health at Royal Society of Medicine, Gabriel Scally, told a British broadcaster that without a lockdown, the virus was going to gain a tighter and tighter grip across the country, which UK's vaccine rollout would not solve. In fact, a former UK Prime Minister Tony Blair also urged the British government to reconsider its strategy and step up its coronavirus immunization program. Blair said that the government should mobilize resources on a scale that has never been seen before in peacetime in the country, and recommended that the whole country should be placed under a COVID inoculation program. Well, to talk more about this, we're now joined by Dr. Vikram Talalukar. Thank you so much for joining us again, Doctor. And you're someone who was a volunteer in the Oxford vaccine program, and that vaccine is now being rolled out in the UK. But first, about the situation in the UK, it sounds very, very grim, and possibly a stricter lockdown.
Thanks for having me on the show, Gargi. Yes, the cases have risen. It's a little bit of a difficult situation right now. That's because the new mutant virus strain seems to be spreading very fast. As we know, it's about 50 to 70% more transmissible. And it looks like the hospitals are under a considerable pressure. Many of us who work in the hospitals have had to be redeployed to help the frontline staff, to help the ICU or the intensive care units, because the number of patients who are being admitted has increased. And that was exactly what was being expected from this new strain. The lockdown is probably imminent, and that's because the only way to really stop more people coming to hospital and stop admissions is to get some time, buy some time by letting people stay in their homes. So there were already Tier 4 restrictions. You could only go out of the house if it was really necessary. But it looks like there may be even stricter restrictions imposed over the next few weeks. And that's because you want less and less people to get this virus and come to hospitals.
Right. And how's the vaccination program been rolling out? We know in the US there's been a lot of criticism about how slow it's been. How has it been there in the UK? Now the Oxford vaccine, we were just getting the first visuals of the Oxford vaccine also being administered. So tell us a bit about that.
Well, but the good part of it is that the vaccination drive is full on. We've already had about 1 million people vaccinated, first with the Pfizer vaccine, and from today the Oxford vaccine is being rolled out. People are quite positive about vaccination. There's actually quite a lot of interest where more and more doctors or dentists are trying to enroll themselves so that they can actually administer these vaccines throughout the country in their own place of practice. The question is, I think, can the production and the availability of the number of doses keep with the rollout of the vaccine? So they're really trying hard to get more and more doses produced. Also, the distance between the first dose and the booster is now about 12 weeks. So the initial idea was to give the first dose and follow the second dose in 21 days or 28 days. That's what the vaccine manufacturers recommend. But we know that most protection comes from the first dose. If you've been given the first dose, then it's very likely you will be protected against severe illness or death. So the plan now is to give first dose to as many people as you can, and you can delay the second dose slightly. So you can give it in 3 months' time, about 12 weeks' time. That's exactly the strategy that's being now rolled out by the public health. So hopefully we'll win the race of vaccination versus how many admissions we are getting in the hospital. That's going to be an ongoing sort of race for the time being. In 2 or 3 months' time, as the vaccination numbers keep increasing, and the aim is to actually vaccinate all the vulnerable population, about 30 million by Easter, we'll be in a much better place. Fingers crossed.
Right. Well, we're seeing again those visuals of the AstraZeneca vaccine being administered, and here in India also we're hoping that we will get it soon. I also wanted to ask you about these reports that were floating around, and these were not confirmed. In fact, perhaps even denied, that children are getting more affected by this, different variant of coronavirus.
Well, actually, its new transmissible strain is much more faster in terms of spreading in children. So they can usually, what you see is as the numbers go up in terms of the community, as the virus spreads more, you're expecting more children to catch this virus and then transmit it to others. So they become spreaders. But in no way this strain is more lethal or more deadly or more dangerous to children. So it's really important that a message goes out there that this strain is not anything different from the previous strain. It's not more dangerous. It's just that more children will get it because it spreads quickly amongst children.
Right. And coming to what, one of the experts said that the vaccinations have to be conducted at a much higher speed. Otherwise, it will be it won't be enough to counter the spread of the virus that we're seeing right now in the UK.
Well, yes, I mean, it's going to be a combined strategy. One is to do a little bit of lockdown wherever there are hotspots of such virus transmission so that you buy time. And in the meantime, we are going to try to keep increasing the number of people who are being vaccinated. So there's no doubt that there is a race here. We've got to keep up the vaccination numbers high so as to let people get vaccinated so they don't have the disease and they don't turn up to hospitals. That's absolutely true. It has to be lockdowns as well as vaccination as a priority now so that less and less people contract this virus.
All right, Dr. Vikram, thank you so much for speaking to us here at NDTV once again.